You're very welcome to this video update. Now today we are going to be looking at some global data, but I also want to look at the origins of the virus, where this virus came from. There's some interesting bits starting to emerge on that, so I want to do as a bit of an update on that. And we've also got some fairly definitive research now on smoking and COVID-19. And to give you the bottom line on that, smoking and COVID-19 don't go well together. Stop smoking if you possibly can. I'm not saying that because smoking causes lung cancer, pancreatic cancer, heart disease and peripheral vascular disease. I'm saying that because it makes symptoms in COVID-19 worse. So that is there. And a bit of an update from the US and the UK, where things basically aren't going too well at the moment. We won't be commenting on the situation in the United States yesterday, other than to say it was a probable super spreader event, because we'll skip the politics on this channel. Now let's just start off with a rough idea of where we are in terms of cases around the world. Now this is a remarkably useful app. I'll put the link in, and it's the case from Canada. So it tells us the cases, and this graph here is particularly useful because it tells us the trend in cases. So just a quick look, there's Canada. So we see the cases are increasing in Canada and the United States. What's happening in Brazil? Well, again, the lines on the graph speak for itself. Africa, very little data in many parts of Africa. We know South Africa's got moderately good data, and we can see the increase there. We believe there's a new strain in Nigeria now, as well as the new strain in South Africa. Again, very limited testing in Nigeria, but the latest testing we do have shows that things are going up. Republic of Ireland, we looked at yesterday, we know cases are going up there. France, it's not good basically any way you want to look. Sweden, dramatic increase. And of course, in the UK, we know only too well. So that's just a quick review of what is going on where in the world. You can spend ages on that. It's actually quite interesting. Now, origins of the pandemic. Let me tell you what got me onto this today. Where the heck this all came from. Now, so that was the global situation. Check that out. Origins of the pandemic. Now, this is from the World Health Organization. Over the past 24 hours, members of the International Scientific Team on COVID-19 virus origins began travelling from their home countries to China. Now, we've looked at the makeup of this team before. It is absolutely world class, as you would expect. Doctors, virologists, epidemiologists, people who know what they're talking about, people who have the expertise to go on the ground and make some fairly good or very good scientific investigations to give us fairly good ideas of how this pandemic originated. Vital information, you might think, to prevent a future pandemic, as well as to understand this one better. So surely everyone is enthusiastic for this to go ahead. Well, World Health Organization saying, this is italic, so it's direct quotes. Today we learned that Chinese officials have not yet finalised the necessary permissions for the team's arrival in China. Necessary permissions? For scientists to arrive, what permissions would you need? We are eager to get the mission underway as soon as possible, they say. Now, this is the World Health Organization speaking in diplomatic language. Of course, other popular news outlets are saying that the scientific team has been blocked. I'll let you decide what you think. Now, China, this is the China Centre for Disease Control researcher. This is the researcher concerned. Now, he's talking about the Qingdao outbreak. Now, you might remember that. It was back in October, and it was attributed to frozen cod. So he said the virus could survive long trips in a deep freeze and still infect people. Okay, that is perfectly reasonable. From a virological point of view, we know you can freeze viruses. That's not a debate. So this certainly could be the case. Imports from abroad caused the spread and transmission of this outbreak. Now, from this, some of the Chinese authorities are trying to intimate that the virus didn't arise in China, it arose overseas. I'll let you decide how much you can extrapolate from one load of frozen cod. Now, going on to the background. Top secret Wuhan Institute of Virology is 11 miles from the wet market where this outbreak allegedly started. What's that? 11, 16 kilometres or something, I don't know. Now, this institute specialises in the study of bat-borne viruses, including coronaviruses. So some might say it's a bit of a coincidence that the pandemic started in a completely unconnected market that only happens to be 11 miles away from this top-secret institution that studies coronaviruses from bats. Now, this is not me. This is from popular news outlets, and I'll give you the references later. Apparently, US officials who visited the lab 2 years ago warned about safety weaknesses and the risks of new SARS-like epidemics emerging from the site. And there's pretty good documentation now that I don't know quite who they were, I think they might have been miners picking up bat droppings. Now, I think bat droppings are called guano, it's used as a fertiliser. And of course, they got a SARS-type illness, which was well documented at the time. So there is a background understanding of this in that area, knowing there's transmission from bats. Now, don't start going down on bats. Bats are a vital part of the ecosystem, as indeed are viruses. It's when people start messing around with it that we have problems. Now, this is interesting. The Wuhan Institute of Virology has been working with prominent Western experts and supported financially by the National Institutes of Health from the good old US of A. Now, this is in several popular news outlets, so I believe it to be true. Several popular news outlets tell us this. Interesting. Now, we're not getting on conspiracy theories. Don't think the channel's gone down market. It hasn't. Deputy National Security Advisor Matthew Pottinger. Now, this Mr. Pottinger is an interesting character. And he seems to be the right man kind of for the job, as far as I know. He's ex-military. He's bilingual, or certainly speaks very good Mandarin. And his brother happens to be a virologist, so kind of interesting combination, really. So anyway, he's been having a chat with British officials, and officials within China have rejected the theory that the virus originated from the wet market in Wuhan, according to the outlets on the popular news from Mr. Pottinger's conversation. Critics fear the probe will be whitewashed given China's influence with the World Health Organization. So some critics, and again, this is not me, this is quoted from the popular press, believe that the World Health Organization is over friendly with China, therefore we might not get to the bottom of things. Now, we on a separate note, we know this pandemic is unnecessary. We know it was covered up in China. On this channel, when we were bouncing up and down screaming for flights to be banned from China, the World Health Organization actually said, no, carry on flying out of China. Doesn't matter, there's not a problem, it's all located in Wuhan. At that time, we knew the transmissibility of the virus. We knew the extreme precautions that the Chinese were taking. We knew the extreme precautions they were taking in Taiwan, who had essentially no pandemic at all. Putting all that together, it was fairly obvious just to me as an outside observer, but the World Health Organization carried on. There's been no apology. The leadership is still there. I would still like Dr. David Nabarro to take over the leadership of the World Health Organization. He's got tremendous medical expertise and qualifications, unlike the current head of the World Health Organization, who is not medically qualified. Anyway, enough said about that. So there's a growing body of evidence to say that the laboratory leak or accident is very much a credible possibility. Now, the popular news outlets are making this a direct quote from Matthew Pottinger. So that's what they are saying. Even establishment figures in Beijing have openly dismissed the wet market story, according to Mr. Pottinger, who we have no reason to assume is not well informed. So we need this World Health Organization team. Now, having made a critique of the lack of intervention, or indeed the World Health Organization saying actually carry on things when I was calling and others were calling for it to be stopped, that doesn't mean to say the World Health Organization doesn't put together world caliber teams. It does. And we need this world caliber team to go in, go where they want, do what they want, when they want, if they want, and find out what caused this pandemic. Because it's unnecessary. For two reasons that we have this pandemic. This whole pandemic is unnecessary. If it hadn't been for early cover-ups and it hadn't been, well, I think the World Health Organization had opportunities to stop it and didn't. Okay, they can't enforce things, but if the World Health Organization like this channel had been bouncing up and down and saying stop flying, then I think people would have probably listened. Just imagine if we'd had no pandemic. I mean, this has blighted the Western world this year. Anyway, so am I hopeful about the origins of the pandemic being discovered? I'll let you answer that question. But we need to try. Now, moving on to what is more definitive, really, smoking. Smoking associated with increased risk of COVID-19 symptoms. Now, this is published in the journal Thorax, part of the British Medical Journal group for chest doctors. And it's from the COVID symptom tracker app, so the data is large scale. So what's the association between smoking and COVID-19 has been the question. Does smoking affect the risk of developing symptomatic COVID-19? And does smoking affect the severity of the the severity of the illness? But both of these questions are answered in the affirmative. So methods. So they took into account the demographics, the anthropometrics, anthropo people, metric to measure. Now this term anthropometrics, I have heard of this. I remember part of my biology degree I had to do this, and it was somewhat discredited. It was quite popular in the 1920s and early 30s, but was discredited in the later 1930s for obvious reasons, as it was abused. But this is back now in looking at the differences between individual groupings of people. So, we can do it scientifically now, so I'm happy with it. Smoking status, of course, they considered. Medical conditions, of course, they considered. Now, anyone feeling unwell on this data was asked 14 questions about potential COVID-19 symptoms that the Zoe Tim Spector app had deduced were relevant to talk about. And the people in the study were also asked about their hospital attendance. And the association between symptoms was also compared between smokers and non-smokers. So basically they ended up with two groups, the smokers and the non-smokers. And this is so often how we do things. We get numbers together, we got large cohorts together, and we compare how did the smokers do, how did the non-smokers do. We have the comparison group. Now, the results you'll be interested to know. Now, data was collected and analysed thoroughly between the 24th of March and the 23rd of April. Quite a long time ago now, but it's given them plenty of time to analyse the data in significant detail with a very good quality statistical analysis. Now, the number of participants at that time was getting on for 2.5 million. Very good. Mean age was 43. Slightly more, quite a few more females than males, interestingly. Overall smoking prevalence was 11% in the group. Now, this is slightly less than the national average in the UK. In the UK, 2019 data indicate that 14.1% are smoking. So what this means is that the proportion of smokers filling out the COVID symptom tracker app slightly underrepresents the total cohort of smokers in society as a whole. Great to see this number has plummeted in the last years and decades. And indeed will continue to go down. Now, of this group, of this 2,401,000, this nearly 4.5 million group, during the study time, 35% of them reported feeling unwell and entered one or more symptoms. Now, obviously, they didn't all turn out to be COVID-19. That's what this app is good at. You can put in the symptoms and it will tell you how probable it is you have COVID-19 based on things that ordinary mortals like me can't hope to understand in terms of the way it mathematically analyses the data. But it's clever and we know it works because we've compared it with other data. The emergent data, however they get it from their clever mathematics, as it emerges, it relates well with other empirical sources of data. Multiple confirmation is an indication that we are getting something that's true. Right. Current smokers were more likely to report symptoms suggesting a diagnosis of COVID-19. Right, so smokers were more likely to get symptomatic. Now, this is not saying who gets infected. It's not saying who gets infected because this is a symptom tracker. It's not saying that smokers are more likely to get infected. This has no way to tell that. But people who had one or more symptoms that were adjudicated to be COVID-19 were 14% more likely in smokers. So smokers were 14% more likely to have one, 2, 3 or 4 symptoms which indicated they had COVID-19 infection. Odds ratio 1.4. So smokers 1.4, non-smokers the risk is 1. So 14% increase. More than 5 symptoms, having more than symptoms, the odds ratio rose to 1.29. Smokers 29% more likely to have multiple symptoms. And when we go on to even higher numbers of symptoms, more than 10 symptoms, smokers are 50% more likely to report 10 or more symptoms. And the other reason that this is interesting is that we know that people that get multiple symptoms in the first week of infection have a higher probability of getting longer term COVID as well. So this doesn't say this, but we can intimate from this that it's quite possible that smoking is a risk factor for long COVID. So pretty good data there from large numbers. This is very large numbers. This data is highly unlikely to be wrong. Very large numbers indeed. Now the group interpret this, and this is interpreted by the authors of the paper in the journal Thorax and the COVID Symptom Tracker app. They both interpret it in the same way. Smokers had an increased risk of developing symptomatic COVID-19, and smokers had more severe symptoms. So smokers at more risk and smokers had more severe symptoms. So now this is related to current smoking status. So from this we can assume that if people stop smoking, they're less likely to get symptoms of COVID-19, they're less likely to get multiple symptoms of COVID-19, and they're less likely to be hospitalised and get severe COVID-19 by 14 to 50% according to this data. So a significant reduction. What we don't know is if people stop smoking, how long it will take for that benefit to filter through. We don't know that. But certainly smoking cessation is advised, purely in terms of COVID-19, not in terms of anything else. Of course, it's not advised for many reasons, as we've said. Now, this chap here, Mario Flauci, lead researcher on the paper in the Thorax journal. Some reports have suggested a protective effect of smoking on COVID-19 risk. However, studies in this area can be easily affected by bias in sampling, participation and response. That is true. Our results clearly, so now we've actually crunched the numbers on this, large numbers. Our results clearly show that smokers are at increased risk of suffering from a wider range of COVID-19 symptoms than non-smokers. So there you go. That's the evidence is there now. So studies that reported smoking has a protective effect, no, they don't. We now have the evidence. Now, Claire Steeves, lead researcher and consultant physician on the Thorax paper. As rates of COVID-19 continue to rise, the NHS edges towards capacity. Well, you could say that again. It's important to do all we can to reduce its effects and find a way to reduce hospital admissions. Absolutely, doctor, we agree completely. Our analysis shows that smoking increases a person's likelihood to attend hospitals. So Dr. Claire Steeves here does seem to be advocating smoking cessation as having a really quite a quick benefit in reducing risk. That's what she's intimating here anyway. So stopping smoking is one of the things that we can do to reduce the health consequences of the disease. Absolutely. So here, this is saying that she expects an immediate benefit, isn't it? So there we go. One more thing becomes clear. Smoking increases the probability of developing symptomatic COVID-19. Smoking increases the probability of getting multiple symptoms from COVID-19. and smoking also increases the risk of getting severe COVID-19. Data demonstrated. Now, just before we finish today, January, this is data from the 7th of January. So that was cases yesterday, that's cases the day before. Very rapid increase, hospitalisations, very rapid increase as well. Well over 30,000 people in hospital now, over 2,500 ventilated. Much higher than the previous peak. Deaths, last 24 hours, within 28 days of a positive COVID test, there was 1,041 deaths. This should be updated. I was expecting that to be today, but I think it's tomorrow now. That number will be updated. This one, of course, is the deaths on the death certificate. But no question, 1,041 people died in the past 24-hour period who'd previously been diagnosed with COVID-19 via testing in the previous 28 days. United States, we've talked about that super spreader event. People are always asking me to make political comments on this channel. We don't. I don't make... people demand I make political comments on the Republic of Ireland, the United States, the United Kingdom, Israel, the Middle East. Well, they can demand away. That's fine. I don't mind them demanding. Not going to happen outside my area of expertise. We just try and work out what the evidence is telling us on this channel. Don't always get it where we'd like it to be, but that's what we try and do. But this is genuine numbers here. Getting on for 250,000 new cases in 24 hours in the United States. And these are just officially diagnosed, of course. 7.8% increase is maintained in the past 7 days. Testing, very good. Over 1.6 million tests in the United States in the past 24 hours. Now, this tells us that the data we're getting from the States in terms of cases is getting pretty good. It's getting pretty accurate now because so many people are being tested. Anyway, testing is up 4.6% in the past 7 days as well. Hospitalisations now stand at 132,000, not a sustainable increase. Just as in the UK, it's not sustainable. 23,707 in intensive care, and that's the number ventilated, just under 8,000. That is actually down about 20 from yesterday, so that's down about 20 from yesterday. Deaths continue to rise. Okay, that's us for today. Thank you for watching. I'm just going to have a quick flick around the infections versus injections with the situation for vaccination. So Canada, slow start. I am very surprised. I had predicted that Canada would have a rapid rollout and be the first country to reach herd immunity. Just 10 days ago, I was wrong. Very disappointing rollout in Canada. Very disappointing. The States, well, nowhere near what we were expecting. Nowhere near. And officials are saying that the delay there seems to be at state level. So it looks like local organisation that's not getting its act together on vaccination in the States. Vaccinations in the UK, 1.3 million, still gearing up. Now, the Moderna is going to start kicking in the UK, we believe, pretty soon. The numbers were low this week because they had to batch test. Now, what that means is this is obviously the vaccine's made in batches. So the vaccine that was used before for the clinical trials is a different brew, if you like. They put on a new brew of vaccine. And you have to make sure that particular batch, that brew, is okay. All the indications are that it is. So that slowed things down a little bit, but we're still waiting for the infrastructure to gear up. I've actually applied to take part in that myself. I'm just waiting to hear back. So hopefully that will happen soon. Republic of Ireland, 4,000 vaccines given. France up to 20,000. These are low numbers. Russia, okay, did it a different way, and China did it a different way. They kind of did their phase 3 clinical trials as they go along. Still not seeing any definitive data from Russia and China in terms of publications as regards their vaccine data. We look forward to phase 3 data anyway. We've got some phase 2 data. Look forward to phase 3 data on that. But leading the pack, so Middle East doing well. So Oman, United Arab Emirates vaccinated 7.7% of its population. So good start in the United Arab Emirates. Bahrain, 4.6% of its population. Israel, 16% of its population. So Israel still leading the vaccination stakes. And we do know, we've had discussions on this channel that Israel, because people seem to get making demands on me all the time about this, but we know from the interview a few days ago with Dr. Balik that Israel is vaccinating all ethnicities within its borders, so regardless of religion or ethnicity. So and we expect Israel to be the first country to reach herd immunity, which is good. Okay, so there you go. You can spend lots of time on that. Sweden doesn't seem to have started. Italy, we looked at the dedicated tracker from Italy yesterday. So well, Saudi Arabia, we haven't looked at that before. Yeah, okay, it's made a start. 100,000 doses. Pretty low percentage of the population, though. Hopefully they'll catch up soon. Germany doing well. Germany's given out. Well, even Germany's a bit, yeah. You sense my frustration at the slow rollout in many areas. Okay, that's us for today. Thank you for watching as always.